Good afternoon, everybody. This is Dr. Alex Samuel, Health Director of the Chesterfield Health District. Today is Friday, December the 18th, 2020. I wanted to give you a pandemic update for the Chesterfield Health District, specifically Chesterfield County. So the post-pandemic surge is noticeable. Cases are at an all-time high statewide, regionally, and certainly within this health district. Across the United States and the Commonwealth, the surge is causing havoc within healthcare systems with lack of beds, resources, and provider compromise and fatigue. So in the United States, there have been over 17 million documented cases of COVID-19 since the beginning of the pandemic. We have seen 1,500,000 cases in the last 7 days alone here in the United States, just to give you some sense of the pace that the numbers have taken. And more recently, the most recent data with regard to deaths is 310,000 deaths in the United States. So at these high community transmission levels, the threat to our vulnerable facilities, including nursing homes, prisons, and schools, beyond that, to our businesses, our economy, and our healthcare systems, and our loved ones is obviously significant and severe. So at the outset, I'm going to ask you again to follow the very simple steps for safety, which include not spending time in a confined space with people outside of your household. Don't participate in group lunches. Don't engage in close conversations with others, inside or outside, in close sets within 6 feet. Secondly, don't spend extended time in indoor spaces, even if most or all the people are wearing masks. Shop quickly, stay 6 feet away from others, do all activities remotely at home if you can. Third, you can safely walk, jog, and engage in other outdoor activities without masking, as long as you maintain that 6-foot social distance from others. And finally, and most importantly, if you are sick for any reason, stay home and either seek medical attention if you need it or seek testing if that seems appropriate in your case. So in Chesterfield, our cases continue to rise at staggering rates. Just today, we recorded 189 cases as of cases documented yesterday. Our 7-day average of new daily cases is at 117, which is really near the highest that we have seen. And even though the current state positivity rate is very high at 11.8%, for this health district, it's at 10.9%. Again, an all-time high and above that 10% threshold that we were hoping to avoid. So I wanted to provide a little bit of information that started last time with regard to vaccines and vaccine updates. Last week, the FDA's Vaccine and Related Biologics Advisory Committee met and voted to recommend approval of emergency use authorization for the Pfizer vaccine in individuals 16 years of age and older. The FDA approved that emergency use authorization over the weekend, and initial doses have been shipped to healthcare systems nationwide. The CDC's Advisory Committee on Immunization Practices met to finalize recommendations on the Pfizer vaccine usage as well. So the vaccine is going to the highest priority groups, which are hospital-based healthcare workers, since they are most exposed to COVID-19. And they need to remain on duty to prevent healthcare system collapse. Additionally, vaccines will be going to long-term care facility residents and staff. Hospitals began their high-risk employee vaccinating early this week. As of yesterday, with respect to the Moderna vaccine, the FDA Vaccines-Related Biologics and Advisory Committee, that's a mouthful, met to discuss again an emergency authorization for that vaccine in individuals ages 16 years of age and older. And the committee recommended that the FDA approve that emergency use authorization. So hopefully today or tomorrow, we'll get that formal approval, and within, I believe, 24 hours of that approval, vaccines, the Moderna vaccine will be shipped to states, and distribution will commence at that point. The advantage of the Moderna vaccine over the Pfizer is that it does not require extreme cold temperature storage, which certainly helps with both storage and distribution. Now, on the Virginia front, the Virginia Disaster Medical Advisory Committee and the Virginia Unified Command voted to officially adopt the advisory committee, this FDA advisory committee recommendations, and provide initial vaccines to both healthcare providers and long-term care facility residents and staff in Virginia. The majority of long-term care facility residents and staff will be vaccinated by large pharmacy chains under a federal partnership. There are an estimated 500,000 healthcare personnel and long-term care facility residents in Virginia, and current plans indicate that we should be getting adequate vaccine to vaccinate those individuals. Hospital systems and health districts will be collaborating to vaccinate healthcare personnel who are outside of healthcare systems, non-affiliated with large healthcare systems, and collaborative efforts are underway to make sure that happens. So it's important to remember that the vaccines may not prevent COVID-19 infection in all individuals. Remember, this is a brand new vaccine. The vaccines may prevent infection in some and will lessen the severity of disease in others. We fully expect the vaccine to help drive case numbers down and prevent overburden of the healthcare system. But we will continue masking and social distancing, however, after we receive the vaccine. When the number of cases fall to very low levels across the nation, when we achieve a measure of herd immunity, we can begin to relax these preventive measures. However, months of vaccination effort will be required to meet that goal. Now, we are getting ready to initiate our COVID-19 vaccination campaign in this health district. And I want to point out again the Medical Reserve Corps, which is our volunteers who have been helping us incredibly along every step of the way through this pandemic. We will need additional volunteers during this vaccine campaign. It will be the single most important response effort that we do today. If you are interested in becoming a Medical Reserve Corps volunteer, or who have family and friends who are interested, please visit www.vamrc.org to learn more. Prospective volunteers will need to create a profile, participate in orientation, complete a background investigation, and participate in required training. However, if you have questions about the process, please reach out to Augustine Doe, our Chesterfield interim Medical Reserve Corps coordinator. The easiest way to reach Augustine is at his email address. That's augustine.doe@vdh.virginia.gov. And that is spelled augustine.doe@vdh.virginia.gov. Or you can contact our call center at 804-318-8207. With regard to general pandemic measures, contact investigation and case investigation and contact tracing, which we call containment. Our containment team is, as you might imagine, with the surge in cases, extremely busy right now. And I would say overstressed by the large number of new cases. And for the first time, we have been forced to prioritize our case investigation and contact tracing efforts and divert them to higher risk situations, namely long-term care facilities, school situations, certain businesses, etc. Most of what we're seeing as far as exposures are household and social spread, very likely secondary to Thanksgiving holiday gatherings. Our executive order compliance team continues to investigate every complaint. Governor Northam, as I'm sure you know, announced new restrictions on December 10th through Executive Order 72, which includes some of the following. There was a mandated stay-at-home order requiring all Virginians to remain at their place of residence between the hours of 12 and 5. Exceptions include obtaining food and goods, traveling to and from work, and seeking medical attention. There's now a universal mask requirement for all Virginians aged 5 and over in indoor settings, shared with others, and when outdoors within 6 feet of another person. So the order expands the current statewide mask mandate, which has been in place since May 29th and requires all individuals, again, age 5 and over, to wear face coverings in indoor and outdoor public settings outside of their own household. These changes are consistent with new CDC guidelines released on December 4th. Third, there's been a reduction in social gatherings. All social gatherings must be limited to 10 individuals, down from the earlier cap of 25 people. Social gatherings include, but are not limited to, parties, celebrations, or other social events, regardless of whether they occur indoor or outdoors. This does not apply to religious services, employment settings, or educational settings. Restaurants and retail stores are already governed by strict social distancing requirements and are not included in this limit. And then fourthly, there are continued limits on dining establishments. Virginia restaurants are currently governed by strict social distancing and sanitation requirements, which I mentioned earlier. The on-site sale, consumption, and possession of alcohol remains prohibited after 10 p.m. in any restaurant, dining establishment, food court, brewery, microbrewery, distillery, winery, or tasting room. All restaurants, dining establishments, food courts, breweries, microbreweries, distilleries, wineries, and tasting rooms must close at midnight. And finally, teleworking. Employees that can telework are strongly encouraged to do so. Remember, we can effectively prevent virus exposure and disease through social distancing, masking, avoiding crowds, washing our hands, and practicing good sanitation methods. These simple methods work well. Our secondary line of defense is containment activity. That's case investigation and contact tracing with extensive testing. These are all intended to control the spread of active infections that we are unable to prevent. However, the extremely high community transmission levels we are experiencing compromises our ability to achieve optimal pandemic containment. So we urgently encourage all of our constituents to take protective measures. Many of us now have personal experience with this virus. Some of us have had COVID-19. Others know someone who has had the disease. Some of us know someone who has died. We are on the verge of access to effective vaccines. We can save many thousands of lives if we protect each other in the coming weeks and months. So if you are sick at all, even if your symptoms do not feel like COVID-19, stay at home, consult your healthcare provider, and don't hesitate to seek testing. The virus can masquerade as many other diseases and can fool us all. We are still hearing stories of people who fell ill, thought they had a bad cold or allergies, continued going to work and socializing with others, and then tested positive for COVID-19. Going out in public while ill is a major cause of COVID-19 spread. We urge you not to do this. And finally, as the Christmas and New Year holidays approach, remember to forego gatherings and large social events. Keep it small and enjoy quality time with members of your household. I want to take this moment in closing to wish you all a very happy holiday season and sincere wishes that you stay safe and healthy. Thank you very much.